Now, one of the areas that I get most excited about and most frustrated when people get this wrong is in the area of preconception or fertility. So, just like our bodies, our cells need the proper nutrients to make what cells do. Our ability to conceive, and in fact, both sexes, this is very important, but women's fertility actually improves when they're properly methylating, and you properly methylate when you have enough nutrients. So I tell my patients all the time, if you work outside, live outside, and grow your organic garden, you don't need vitamins. You don't need anything. You just keep eating what you're eating. But for the rest of us that lead stressful lives, we're very busy. We eat genetically modified foods. Even if you're trying not to, you wind up having to. You eat foods that have a lot of pesticides and insecticides and fungicides and all these ides on them, and they're impairing our cells to perform, creating an epidemic of migraines and fibromyalgia and infertility and miscarriages. So cleaning our diet up is very important, and then the vitamins help clean that up, but then your vitamins provide for those cells to do. So I love RestoreV in someone who's trying to conceive and trying to clean up their metals and get the lead and mercury out, which we know are a problem with autism. Getting their vitamin D levels up. There's a good level of vitamin D. We want D up in somebody who wants to conceive. That appears to be helpful for the developing brain as well. Those particularly with the MTHFR that have a double whammy. So if both parents gave them a change in MTHFR, which means they can't process the folic acid, well, they really need the folate to bump the folic acid out of the way so they can get the good stuff. So, and some women are really profoundly low in their ability to perform methyl groups or get methyl groups, and so they're just not getting pregnant at the same rate. So I think every woman should not be on a folic acid vitamin. I think they actually should be on a true folate the way it ideally should be, the way the cell wants, the replicating cell, the cell that's forming a new life. They need folate, and when they're on folic acid, it is very frustrating. And you know, I go over this with my family and those who are trying to conceive. This is a big issue, and I think it needs to be addressed with the right nutrients. So folic acid is important, but its name needs to be folate or L-methylfolate ideally, and methyl B12 and the right B6 and all that to get it just right. I like fish oil as well. Some need more vitamin D. Probiotics are very important. Having a way to eliminate metals, chia seeds, for example, those are important in preconception, and it's best to start months ahead of time, so it's not just a last-minute thing. But if you're pregnant, you want a great vitamin, and you want one that has folate in it. Preconception, I would recommend those things I just said to increase your rates of fertility.